Fantastic. I see people logging on. Welcome to the webinars. I think we're waiting for just participants to join. So for those who've joined us today, karibuni sana. We'll give everybody just a few minutes before we get started. So if you hear silence, it's because we're waiting for people to join, not that we don't know it's time to start. So let's give everybody 2 minutes or so. Then we'll get started to what should be a fairly exciting and interesting conversation. All right, I see we have at least 100 participants. And so in the interest of being respectful of everybody's time, let's get started. Hello, everybody. Good evening to those who are dialing in from far east. Good afternoon to those who are on the continent. Good morning to people like the BC who are in the Americas. Welcome to this session of Africa Dialogues, which for those who are new to this webinar is a collaboration between Amref Health Africa and Dalberg Advisors, two critical institutions that began these conversations around the COVID pandemic in 2020. The first phase was very much health focused around the pandemic. And the second phase, which is where we are now, is really asking the question is how do we build back better? How do we make sure we are cognizant of the changing dynamics that will affect people's health outcomes, but also what are the things that need to be done to prepare our systems, our health systems in particular, to be responsive to those changes. We try and maintain a fairly informal level of conversation. So, please use the Q&A panel to ask questions. Please engage with each other in the chat group. As mentioned when you logged in, this is a recorded webinar, because there are snippets of the highlights of this conversation that will be distributed far and wide. And there are interpretation services that are available. So if you are a French speaker, you can use the interpretation button so you make sure that you're following the conversation as we go along. As you can tell today, Dr. Gethenji Getahi is not with us. And in some ways, it's a great relief that he's not here, because Liz and I have been trying to champion the need for people with hair to be the ones who actually kind of host this conversation. So Liz, karibu sana. It's good to have you.
Thank you so much, Edwin. Happy to be here and happy to co-moderate this with you on a topic that I'm really passionate about.
Yeah, it reminds me, there's a Swahili saying that says, akili ni nywele kila mtu anazake, which essentially means brains are hair, everybody has some. And so Dr. Jihu has very little of hair, but lots of brain, is the kind of the one who doesn't quite conform to that. But great to have everybody on. And so today we're talking about climate change and the impact that climate change has and will have on lives and livelihoods across the African continent. Most of you are familiar that Africa has been the smallest contributor to greenhouse gases, estimated between 2 to 3% of emissions, but we are reaping the hardest, we're disproportionately affected in the outcomes or the consequences of climate change. And that's in health, where we've seen the WHO has said about 56% of the public health events, over 2,000 public health events recorded on the region over the last 20 years were linked to climate change. The WHO expects that the continuing change of the environment will cause at least 250,000 additional deaths per year from malnutrition, because it affects our agriculture, from malaria, especially in the distribution of disease into areas where people do not have immunity, or the health systems are not prepared to deal with those, diarrhea, as well as heat stress, as we've seen happen in the global north. And so this is increasingly such an important point and an important issue that it is important, it is critical for us to be on the front end of the discussions to understand the context in which climate change is happening, but also beginning to reshape and transition our systems appropriately to respond to those. So to give that context, we will play a quick video, about 1.5 minutes of a video, to just give that broad context. And then I will hand over to Liz, who will introduce our panelists for today and lead us to that initial set of questions. But we're looking for active participation from everybody. So please share your thoughts, perspectives, questions in the chat or in the Q&A, and we'll very much weave those into the discussion. So Maurice, if you could please cue the video, that'd be fantastic. Fantastic. Over to you, Liz.
Thank you so much, Edwin. Indeed, as the video stated, and as you so aptly put it, the grave, impact of climate change, and together we can stand up for our planet. And this is the context or premise of why we're having this conversation today. We have a distinguished panel of thought leaders in this area, and they'll really unpack the nexus of how the impact of climate change is affecting health, is affecting agriculture, and is affecting, in a larger space, the economy, the social, economic impacts that we're all experiencing. And without further ado, I'll start with Dr. Debisi Araba, who joins us. In his end, it's in the morning. So good morning to you, Dr. Debisi. And Dr. Debisi is a visiting research fellow at the Center for Environmental Policy at Imperial College London. He also serves on the Montpellier Malabo panel of experts, which is an eminent group of global experts working together to enhance Africa and European governments to support national and regional agricultural development and food security priorities in Africa. So karibu sana, Dr. Debisi.
Santi, thank you very much.
Thank you. Next up, we have Dr. Nora Obutho, who's the East Africa and Global Health Integration Director at Women Lift Health. She has been at the forefront advocating for women and young girls. And as you've seen in the video, that's where the impact of climate change and the nexus of health really impacts the most negatively. And she's also been focusing a lot on public health programs with women and children. So welcome very much, Dr. Nora, who's here in Nairobi.
Thank you very much, Liz.
And last but certainly not the least, Dr. Abu Bakar Tarawalia, who prefers to be called Abu, joining us all the way from Sierra Leone, in Freetown, Sierra Leone. He's the Deputy Secretary General for Mamo River Union Secretariat. Dr. Abu has published over 30 journals, articles, and has done extensive work on impact policy research studies across the areas that we will be focusing on today. So welcome very much, Abu.
Thank you for having me.
Okay, perfect. Thank you all. And just to set the ball rolling, I'll start with you, Debisi. You've been previously quoted from articles, from news pieces that you've done, advocating for data as a spotlight in mapping food surpluses and shortages and responding with strategies that will protect Africa's health and nutrition. And we know that nutrition is a big issue, particularly in areas where drought is rampant, as we're currently experiencing in East Africa. Can you speak more about how the agriculture sector can leverage data to ensure food security for all people, and also how agriculture institutions and health institutions can work better to mitigate the dire effects of malnutrition, for instance?
Sure. Thank you. Thank you very much, Liz. So what we're talking about is not just climate change, or the nexus between climate change and food and nutrition security, or climate change and health. It's really about resilience, and resilience in the broad context of how we thrive as human populations. There are lots of shocks and stresses. I think we have been talking about climate change, but maybe over the last half decade or so, the impacts, we're feeling the impacts more frequently now, whether it's more higher variation in rainfall, temperature, higher temperatures, lower temperatures, we're getting peaks and troughs that previously weren't experienced before. And of course, it then has its impact on the Earth's ability or capabilities of producing food through natural processes. So in addition to the immediate impacts of climate change, you get your floods, your droughts that will have shocks. You then have these stresses that are reducing over time the ability of systems to give optimal output. For example, the increasing concentration of CO2 in the atmosphere is reducing the ability of plants to bioaccumulate nutrients. So our plants, our crops, are becoming less nutritious over time. And that's not something you can see, it's something you have to test in crops. So in addition to, the shocks of if we get a flood that washes away or destroys a harvest, or destroys a crop, or reduces the availability of a crop, and then of course that leads to scarcity and increases prices in the market, you then have the second issue of long-term reduction in nutrition or nutrition availability in crops. So we are facing a it really is an existential crisis. I don't know how else to ripen the issue for you, but for the sake of the listeners, this isn't something you listen to and you turn off the radio or you move on to something else. We are not going to ignore this because it's not going to go away. Now, in terms of the technologies that we could be adopting, and why data matters, or why I believe data matters a lot, one of the things that we pioneered when I was the director at the International Center for Tropical Agriculture, CIAT, was the Nutrition Early Warning System. Now, what was that? Nutrition Early Warning System was going to aggregate information from multiple data sources, and then run that through an artificial intelligence algorithm to ensure that we could anticipate shocks, food shocks, nutrition shocks before they happen. I think what you see when you watch TV or you read in the newspapers is always the after effects. So when there's the food scarcity. So what can you do as mostly for governments? As a government, what can you do to anticipate these shocks and act before it happens? So let me give you an example of what a shock could look like. If you get a flash flood in some locality that washes away a bridge. Now, that's the event. A bridge has been washed away. But the second order impact of that is maybe that bridge is the conduit for moving food from production hubs to consumption hubs. Once that bridge is washed away, we then know that a community has been cut off. So what can we do to then ensure that that community gets reconnected to food supply chains? The other thing, and I think everyone experienced this in 2020, regardless of your economic status, was how everyone got cut off. If you were in a country that shut down, or if you were in a city that was locked down at COVID, you would ordinarily assume that urban areas are immune from these types of shocks. But what we found was that urban areas are the most vulnerable. Why? Because your supply chains, your food supply chains, you don't grow food in urban centers. You grow food in rural areas. If you lock down a rural area, at least you are within the food production hub. An urban area is a major food consumption hub. That's where most of the food is consumed. However, if you lock down and there is no movement, of people or goods or services, then you are condemning people to, some people would call it urban poverty. But there are issues that people didn't anticipate, second and third order impacts. And so the nutrition early warning system is working to anticipate these second and third order activities and ensure that we go less from emergency food aid and more to anticipating, and we build, whether it's disaggregated food distribution systems, refrigeration systems, however we do it, we ensure that we don't go through these cycles of boom and bust. You would see some African countries, I don't want to go into specifics, so I don't prejudice anyone or it seems like I'm casting aspersions, but you will find that some countries are prolific in food production. But then in the face of any climate shock or stress, whether there's a drought in any season or a flood in any season, it then goes from surplus to food emergency. And then you are airlifting food, and you have some international agencies dropping food into countries. And what we don't, maybe the other part that we don't appreciate, for the benefit of the audience, is that is not a sustainable mechanism. You cannot parachute food into communities long term. You need to ensure that societies are able to develop local systems to thrive in the face of shocks and stresses. So not just absorb these shocks, but thrive in the face of shocks and stresses. So we will continue to have these shocks and stresses. We initially used to focus on mitigating humankind's contribution to climate change, but now we realize, look, we're within it. We're within climate change now. So we need to adapt. We need to adapt to these cycles of floods, droughts, the heat, and all these other shocks as well. So, COVID has taught us that, we can't take our eyes off the ball. And the hope is, if we can develop mechanisms to build resilience to climate change, it perhaps helps us to also build resilience to other shocks and stresses. So COVID, or if we are potentially looking at a global economic downturn in 2023 and beyond, how will economies cope with this? Some people are saying, produce more food. But then if you produce more food, for economists, I think, of course, my knowledge of economics is nothing compared to what Edwin's is. But, if you produce more food in a short space of time, what you're doing is you're depressing, or you're making more of a good available. And if more of that good is available, what's going to happen if the market can't absorb it all? Price is going to depress. And if that happens, you're just tanking markets. If you tank markets, there is no incentive for the farmers to plant for the next season, because agriculture is a business. Agriculture isn't charity. So every food you consume, understand that there was the prospect of profit that went behind the production of the crop. So we really need to bring in a multimodal, multi-sectoral approach. This is why data is important. It's not just data for food production or crop production. It's data that improves decision-making across the board and enhances resilience. Thanks, Liz.
Oh, great. Some great points to think about there. I really love your the innovation that you talked about, the nutrition early warning system. And before we get to some of the key milestones that have been achieved through that, I want to bring in Dr. Nora Obutho, because she's been front center back when it comes to women and girls. And we've seen, even when Debisi is talking about the impact, there are things we cannot see, like the food losing its nutrients, the crops losing their nutrients. It's something that we really cannot see. You've shared your thoughts on the impact of climate change to women and girls in Africa. You've called for transformative leadership to address these challenges, particularly on the intersection where health comes in. What are some of the gendered impacts of climate change that we're beginning to see on health and well-being of Africa's population, contextualizing also with what Debisi has mentioned about the impact in agriculture and food?
Thank you, Liz. I think this is a very exciting topic for me, focusing on women and girls, and of course, looking at this nexus of health, gender, and climate change as well, because we always look at it as something so far out. The heat stresses, the wildfires, they're out there. They're not they're not too close to us, particularly for us in the health sector. We want to see the patient who's unwell, who has come with malaria, give the medication, we are done, moving on. What are we talking about? The sun and the water and the air. But all this really matter. They are what we call the prerequisites of well-being, simply, or what we also in the health sector talk about the social determinants of health. This is food, it is water, it is good quality air. This determine your health. So even with what the BC has spoken to in terms of the agricultural impact, in terms of how climate is affecting it, the quality of the food, the quality of the soil, the production, distribution of food, this is critical, because without food, then you cannot be having your nutrients, your body cannot be functioning at optimal levels. So this is definitely an intersection that we need to be looking at. When it comes to, of course, the gendered impact of climate change, and this we really want to just say that there's this disparate impact of climate change on men and women. And this is just really based on the social construct of the general roles and relations that we have, and they affect health. And climate change for sure is not gender neutral. And when we want to look at how this is posing a threat to women and girls as well, we can look at how it is amplifying existing gender inequalities in a way in which it's threatening the way of life and livelihood, health. We can say even safety as well, and security of women and girls. And why is this? Because if you look at women and girls, even in the rural sector, which is a majority even across Africa, they're the ones depending on the natural resources. They're the ones tilling the land, providing the food, responsible for securing that food, water, and fuel to the families. So this is a very critical area to appreciate, because when we do not have this, we do not have water, or how climate change is taking us through this exposure pathways, whether it's bad quality air, whether it's lack of water in its quality and quantity, then we find that we have effects of drought and erratic rainfall. So who's going to work in those, who's going to till that land if we do not have rainfall, if there's drought? How are we going to feed these families? And the women and girls are caught up in this. The women will have to work extra harder on this land. They'll probably call in the younger girls to come in, and they miss out on school, so that they can, rally together and produce more food. And this is going to impact everything that a woman is going to do, whether it's the health, access, quality of life within a household. That is going to come to play. When we look at climate change as well, we're also saying that it's what we call, it's a threat multiplier. It escalates social, political, and economic tensions in fragile and conflict affected areas. So we can say that these vulnerabilities will come through, gender-based violence, conflict-related sexual violence, human trafficking, child marriage, teenage pregnancies, which we saw really go up even when we were looking at, aftermaths of COVID, when sexual and reproductive health services were cut off, maternal health services were cut off. We saw the effects of a system that was truly not resilient in terms of the health systems. But even when we look at these vulnerabilities that the women and children will have in a state of a fragile and conflict-afflicted setting, then we see that even with the disaster, they are less likely to survive due to the already existing disparities, whether it's in information, their ability to make decisions because of the economies of scale, whether it's their mobility and access to training and decision-making. All this come to play and further increase their vulnerability. When we look at the aftermath as well, so we've come and we are trying to support a certain community to recover from this threat, whether it's due to the social, political, and economic tensions that have arisen. Women are less likely to access this relief and assistance further. And what happens here is that we end up going into some loop of, more disaster, increased vulnerability, another disaster, because the system is not recovering. How can the system recover when we're not involving the women and the girls in this process, in the design of recovery, in the process of, building these resilient systems that we are hoping to achieve? So when we look at it in totality, we cannot isolate climate change and the effect it has in health, and particularly the gender impact it has on health. So I think this for me is something that we have to rally on, include women, engage communities, let them be part and parcel of the solutions. Let's have the women front and center in decision making. Let them have that space on the table to design solutions that highly affect them in these communities. Thank you, Liz.
Okay, thank you so much, Nora, for those insights. And I see Cyprian Comber, who's added a point saying, how do we ethically and meaningfully engage youth in these conversations around climate change so that there is the inclusion narrative that you've really articulated? I want to bring in Abu. And Abu, do you feel that Africans across the continent are engaged enough and passionate enough about climate change to act on it and hold their leaders accountable to commitments that they have made? Just even going to the point that Nora did mention about, sometimes we see some things happening in other continents and we feel like we're in a safety net. Abu, do you feel that Africans in the continent are passionate to hold their leaders accountable on the climate change impact and what we have committed to? Abu?
Yeah, thank you very much. And let me join Dr. Devisi and Edwin to re-echo the relevance of this topic. The climate change health nexus is very key and very passionate and very good for a particular economy. Of course, most Africans have heard about the climate change and they've all agreed about the detrimental effect of climate change on our environment in terms of on agriculture, the environment, and the broader economy as a whole, as articulated by Dr. Debris and re-echoed by Dr. Nora. So I don't want to bore into that. But I believe most Africans have heard about climate change and have agreed that it is something that needs to be stopped, something that needs to be addressed. Like Dr. Rebis rightly noted in his initial stage, Africa produces almost 3 to 4% of carbon emission, but they suffer the most. And why must that be the case? Needs to be done. And there was a study done by Nicholas Sampson and et al. And they found that 2/3 of African perceived climate conditions for agricultural production had worsened over the past 10 years. That study was done in 2021. And among Africans who have heard of climate change, 71% of them say it needs to be stopped, and 51% thinks that something needs to be done and government needs to be held accountable. Based on the fact that they look at the negative effect on climate change in terms of drought, in terms of food insecurity, in terms of environmental hazard, in terms of health and all that. So they believe that government needs to be held accountable for climate change, and also private sector participation is also key in this case. Of course, the youth, again, like Madam Dora said, are also passionate. I read something wherein they said about 10 youths are trying to champion the cause of climate change in the sub-region from various regions from South Africa and into this. And I believe government needs to be held accountable for this based on certain factors. We notice, like, for instance, within the west coast of Africa, especially within the MRA region, timber logging, deforestation has become a norm. Government sees it as a source of revenue rather than, they look at more on the economic impact, the revenue it generates, rather than the social and negative spillover effect it has on the environment in terms of deforestation and then affecting both current and future generation. And most people also believe that government budget allocation towards fighting climate change remains very low. They tend to prioritize their budget in areas that are not environmental friendly, that do not pursue climate change issues, that do not address climate change issues. And furthermore, the land tenure systems in most African countries tends to provide the ambience that tend to propagate, that tend to promote climate change, deforestation, and depletion of the natural resources. While some other areas, they have, like the Abuja, let's assume the Abuja city, there were certain policies being implemented for land construction, land allocation, and all the rest. But by and large, in most African countries, land tenure system tends to create a kind of fight between citizens of the country, especially within nomads and farmers. For instance, you see most of the time in some other areas, cattle areas grazing on land of other people, cultivating their crops, and then creating a kind of political infight that also contributes to degradation. And we also notice that in some areas, they grant licensing to like miners without taking into consideration the environmental impact those mining activities may have on the environment. They look for short-term gains in terms of revenue mobilization, and these mining companies will bring about without taking into consideration corporate social responsibilities of these miners towards the environment. We may notice the case of Nigeria, the spillover of the mining oil companies in most of these Niger Delta and other areas. You see. So these are some of the areas that we believe government needs to intervene and then try to speed up and find a way to mitigate the impact of climate change on our environment if the current and future generations are to benefit from this. Thank you.
Thank you so much, Dr. Abu, for those insights and for really just contextualizing, stating some statistics and some critical examples that we are having here in Africa. And like you're saying, there is some work being done by African governments, but a lot more needs to be done. And it's a case of prioritization, since we're dealing with quite a number of emergencies or issues that are emanating. I want to pose this question to Debisi as a member of the group of global experts for the Montpellier Malabo panel of experts, because this is where I feel this would fall into. How do you feel, or how can we position agriculture as a pathway to prosperity in Africa in terms of unexplored opportunities that are specific to African countries? I think the example that you gave for the nutrition early warning system, and if you can share some great milestones that have been achieved through that and many others, it would really help us to see how that vision looks like.
Well, thank you. Thank you very much, Liz. So with the nutrition early warning system, well, I mean, I'm no longer at CIAT, but the team at CIAT, what they've done and done very well is bring together the data points. Because again, your information or the advisory that you bring out is only as good as the quality of the data that comes in. So working with UNICEF, the UN World Food Programme, and a few other development partners that are invested in acquiring data points that are either connected directly into the agriculture sector or agriculture adjacent. So meteorological information, information on infrastructure, information on social indicators, et cetera, and synthesizing this to improve advisories, both for governments and other institutions that are relevant to this. Of course, we think adaptation to climate change will happen at different scales. At the household scale, I was going through the Q&A, just checking to see if we were connected with our audience in spirit. At the household level, looking at agriculture and climate change, there will need to be, so starting in farming communities, there will need to be changes in farming practices. We need farmers to adopt technologies and practices that adapt to the climate realities that we face. And to get that done, we need extension services, improved extension services. So the traditional form of extension service would be, having someone go into the field and showing people how to do things. Now, that of course has led to this huge gap in a ratio of extension agents to farmers. So you have in some countries a nightmare scenario of one extension agent to 100,000 farmers, where, how are you going to train 100,000 people one-on-one? It's not going to happen. So we are looking to invest in digital tools and services to extend these trainings and these learnings to more people and make sure the training is on time and on demand. So by investing in digital tools, Again, I am not of the school of thought that says, oh, illiteracy, digital illiteracy is such that, it's a self-defeating effort to invest in digital tools. We are advancing as a society. You have, you go into the most rural parts of Kenya where I live, well, mostly where I live, I'm currently in the States, but if you go and you have 3G, 4G connections. So we know data penetration is, getting deeper in most countries in Africa. The cost of acquiring devices, digital communication devices, is coming down. And so we are betting on the future. And the future is Africa will be more prosperous. And if Africa is going to be more prosperous, then we need to invest in these digital tools. So these digital tools, for example, can serve as repositories for training on the new practices, the new technologies. And of course, we then also have to bring down the cost of acquiring technology. So how do you purchase irrigation systems, whether it's solar irrigation systems or more energy efficient systems, financing systems for affordable seed. So when some farmers purchase seed, if the seed is aligned, if the seed variety is particularly aligned to the climate or the seasonal forecast, then how can we ensure that the farmer pays a cheaper price, a lower premium for that? So if you purchase seed, say you purchase a maize seed that is drought tolerant, and we know that the forecast have predicted drought-like conditions for that season, can we ensure that the farmer also gets insurance with the seed purchase? So it's about bringing things together, synthesizing and bundling products, but putting do we call it the magic? Putting the magic behind the scenes. The magic can't be in front. So what you don't want is a farmer to purchase seed, purchase insurance, purchase finance. You can't be doing all these things. There are too many decisions being made. So can we design nudges that move a lot of these interventions behind the scene? So all you're asking for farmers to do in this particular context is make the right decision, buy the seed that gives you the best shot of being productive in any specific farming season. So that's one example. The other things that we need to push to ensure that we are competitive, and it's not just about surviving climate change. Africa needs to fulfill its potential as a breadbasket of the world and feed the world. And so how do we ensure that we increase the flow of financing into the agriculture sector? At all scales, large scale, commercial, small, and at the smallholder level as well. Finance is highly viscous right now. It's sticky. It's risk averse. So how do you de-risk the mechanisms of pricing financing or costing the extension of financial products and services to the agriculture sector? It's through science and knowledge. And so we have across the continent armies of scientists working in countries through the National Agriculture Research Systems and also through the International Agriculture Research Consortium, CGIAR, working to synthesize the science. So through field experiments, they synthesize the science to inform the financial service sector on areas that they can improve investment decisions. So for example, two products, we have the Climate Smart Agriculture profiles that profile countries, look at the vulnerabilities to climate change, and then how you can adapt to climate scenarios, but also Climate Smart Agriculture investment plans. Because as an investor, you are not just investing in the present, you're investing for the future. So how can your investments be not future-proof, but at least future-sensitive? No one can predict 100% what's going to happen tomorrow. Hindsight is always 2020, but we can, to a large extent, insulate investors from shocks and stresses going into the future. And when I say investors, I mean everybody. So a smallholder farmer is an investor. Trust me, if you've either farmed, I farm. I have a fish farm in Nigeria. If you've farmed, then you know that each season you are making an investment decision, and it's a big bet on the future. So how do we help investors and these business people who are trying to make a living, but at the same time feed Africa and feed the world? How do we ensure that they stay profitable? And it's through the science. It's the science that would inform their decision. So It's also how we then downscale that science. So we have the science, we have the knowledge. How do we get that knowledge into meaningful advisories to these people? It's through extension services, it's through products, it's through the financial services sector, and it's through these nudges that will happen behind the scenes. A farmer doesn't need to understand the intricacies of how we design insurance products. You know, whether it's parametric, meaning you're designing the insurance product on weather indicators, or non-parametric, or whether it's area yield insurance. Whatever the insurance is, the farmer doesn't need to understand the intricacies. The farmer just needs to know how they thrive in the face of shocks and stresses. Thanks, Liz.
Thank you, Debisi, for that. I think you really, to sum it all up, it's about knowledge is power, information is power. How do we equip the farmers, from the smallholder farmers to the large-scale farmers? And the second component is on the investment part and the role that each person has to play, whether it's a small investment or major investments into the insurance, which is really interesting. When you were starting, you did mention you wanted to know whether our audience is in sync with us, and I can see, oh my goodness, there are lots and lots of questions from everything that each speaker has talked about. And I had a question for Nora, but let me ask this, that's coming from Blessing Beru. I know we have the last section around questions from the audience, but this really speaks to what you answered in the very beginning. And Blessing Beru says that behind every successful man is a woman, but also before every poor woman is a poor man. While the climate change effects may be gendered, is it really optimal for Africa to begin focusing on gendered approaches with climate change effects, which really have devastating implications for communities and affect men and boys similarly? Is a male-female distinction necessary for Africa at this point? Or is it just academic distinction? So what can we do, or how is the whole conversation of men and the boys and the boy child, how are we ensuring that the boy child is not left behind?
Thank you. And I know this is a very, it's a very, something that we really discuss, and we feel that the boy child is left behind, too much focus on the woman. What we are appreciating here is that when we talk about gender, it's not woman. Gender is woman and man. And even as we are trying to pull up the women, because they have greater vulnerabilities in comparison. Not that when we speak of the children, we're saying that we want to save the girl child alone and leave the boy child on the side. No, we are appreciating that women, the youth, and girls are facing, they're basically marginalized. They have higher vulnerabilities, and we do not discount that the male counterpart also have vulnerabilities. But we're saying that we support these women, because at the end of the day, the woman is one who holds the household in terms of even health access, health management in the home, nutrition management in the home. If she is not empowered, then the home is not likely to stand. And that is why we are trying to push the women's agenda, not leaving behind the men, because women do not exist in isolation. We are in an ecosystem. We are simply just trying to bring up the woman, and we can have that level of parity, even in leadership. We're not saying that women should take over. We're looking for leadership parity, because when we have leadership parity, then we have quality of decisions that are being made, because women are bringing in their lived experience, which has often been left behind. So really, we are trying to pull in the woman and still working with the men, because we are in this ecosystem together. Yes.
Absolutely, Nora. And I can see quite a number of comments around ensuring that men are not left behind. So thank you for articulating that, and just mentioning that we're unpacking the whole systemic issue of how the women come in play without necessarily leaving the men behind. Dr. Abu, as someone with a strong understanding of the legal and economic frameworks within which countries operate, in your perspective, how can African governments work together to formulate enabling policies to advance health and development goals within the context of a rapidly changing political, economic, and environmental landscape threatened by emerging crises as we are speaking about right now, climate change?
Thank you so much, Liz. And this is very doable, and this is one of our main objectives within the MRU in terms of regionalism, regional projects, rather than thinking nationalistic or individual countries, because there are certain projects that cannot be done by an individual country because it's a transboundary issue. So it may have a spillover effect on the downstream user or the other country. So it has to be on a regional basis. And there are certain things that needs to be taken on board. One, I believe the political and the economic stability of the region or the member countries needs to be very strong. If the region is in war or political impasse, then there will be disaster, sure that nothing progressive will take place. So you must ensure that there is political stability, there is economic stability in terms of the macroeconomic fundamentals must be strong, maintain your exchange rate, maintain your inflation, provide an enabling environment for private sector investment, and then create that ambience and reduce the cost of doing business. This will also improve FDI inflows into the region, and then that will help to speed up production in terms of agricultural productivity and other areas and mitigate the impact of climate change. So political and economic stability is very key in this scale. And second is that, like I said entirely, regionalism takes the fall. Most of these economies belong to regional economic blocks, like the regional economic bloc, the East Africa economic bloc. We have the MRU, we have the ECOWAS. This speaks to the fact that certain activities cannot be done by a single country. It has to be on a collective basis. Like there are certain infrastructure projects that require huge sums of money, huge investment outlay that cannot be taken on board by a single country. It has to be a joint effort with source of funding from donor partners and the like. And so regionalism play a greater part, especially in terms of infrastructure upgrade, in terms of research and innovation. There is need for countries to come together, pool their resources, act as one, and then create that kind of situation where in the production of the goods and services or the infrastructure will benefit all and sundry. There is also the need to invest in research and innovation. Certain activities like we saw what happened during the COVID, even though countries have individual impact, but the production of the COVID vaccine and something was a collective effort. Countries pull up their resources with funding from the WHO and other donor partners, and then there we have some of these vaccines and these antidotes to contain this COVID. So there is need for investment in research and innovation, so that will help to mitigate the impact of climate change, especially on health. Other thing is that there is need for member countries to domesticate regional or international laws, treaties, and policies. We observe in most cases, countries sign up to international treaties, but they find it very difficult to implement short treaties within the domestic economy. So it must be a matter of more that countries tend to domesticate these international treaties and policies, which will help to promote the good image of the entire region and then help to mitigate climate change. So regionalism in terms of domesticating international laws or international treaty also serves another. And in addition to the regional and national laws, there's other laws, global laws that needs to complement these regional and national laws in order to strengthen the issue of regionalism and have a win-win situation, which will help to mitigate climate change and have the desired objective that will enhance living standard, improve growth and development, and strengthen the health sectors, the environment, and the broader economy. Thank you.
I have a quick follow-up for you, Abu, because in some ways, climate change is all up, there's a big part of climate change that's about collective action, right? And as somebody who sits in the middle of trying to bring all these countries together to act, how do we make sure that this doesn't become a lowest common denominator type situation, right? Where people do the basic barest minimum and are not willing to push beyond because you actually need everybody to engage and act. And we've seen that be an issue at the global level. When you think about the situation on the African continent, what can be done, what should be done, so that we can actually get ahead of the issue. Otherwise, we will always be behind and trying to catch up because we're running at the pace of the slowest person.
Yeah, thanks so much. If you look at the global economy or look at sub-Saharan Africa or Africa in general, you have the big economies, you have the small economies. And I believe the big economies must be able to drive up the small economies in order to achieve a desired objective. In terms of, let's say, contribution towards research and development, you cannot expect large economies to contribute equal proportion of their GDP towards the revenue that is required to advance these kind of things. So there must be a leader and followers. The bigger economies, look at the case of the Eurozone or the EU. We also saw that the Germans and the French actually drive the process of regionalism in terms of the EU, whereas these smaller countries came on board and see. So there must be certain economies must take the lead. The South Africa, the Nigeria, they are big economies, must take the lead, the Kenyans to some extent, to drive smaller countries like Sierra Leone, Liberia, and others. So there may not be equal benefit or equal contribution towards the global platform, but certain proportionate representation must be made sure that the bigger economies drive up or pull up the smaller economies in order to achieve the desired objective.
And from where you sit, are you seeing that happening? Or is it still, too slow, too little, too slow?
It's too slow. It depends on the political will. Let's take, for instance, like in West Africa, like we have the West Africa Monetary Zone, that's the WAMS. We are in the one to form the single monetary union with a single currency and a common central bank. Nigeria and Ghana are the big players. Sierra Leone, Liberia, Guinea are small players. Are these big players willing and ready to cede their economic sovereignty for the betterment of the entire economy or the betterment of the region? That's an entity. It depends on the political will of the country in order to give up its sovereignty for a kind of Pareto optimality to operate within that particular zone. But if countries are not ready and willing to cede in their sovereignty and then pull over the smaller countries for the gain for the entire region, it will still be a problem. And that's what we face globally in most regional economic communities.
I was trying to be cheeky and get you to actually name names, but you gave such a good politician answer. So I'll hand it back to you, Liz.
Noted.
Thank you so much, Abu, for just contextualizing that for us. I can see so much engagement on our questions Q&A segment. So I'm just going to dive into some of those questions that have come up as follow-up from some of the things the panelists have mentioned. Lusungu Harawa, who I'm guessing is from Malawi, is asking, climate change is negatively affecting health outcomes for adolescents and young people, especially living with HIV and AIDS. How best can we bring in adaptive measures? I'll pose that question to Nora.
Thank you. And I think the adaptive measures, it's a good question. How do we address this? Because this is really basically a health system issue, and how we are trying to ensure that we integrate climate change agenda into the health system process, so that we also achieve universal healthcare. So how we could do this is ensure that there's integration. So there'll be adolescents, young people, there'll be HIV positive, people living with HIV, so to speak. There will be those with non-communicable diseases. They're all in this spectrum, and they all need to be addressed in terms of looking at the health system. And when we're looking at the health system, what I'd like to focus on is that we need to integrate climate change effect strategies within our health system. And it would be something akin to what CDC has. They have something called building resilience against climate change effects. There's a framework around that. And we can adapt that even in our health systems, where we're trying to look at what can we anticipate in terms of the climate impact and being able to assess vulnerabilities. And we're going to be able to assess vulnerabilities for those, young populations, for women and girls, for, those with non-communicable diseases, because those are vulnerabilities. It'll include even the LGBTQI+. Those are vulnerable populations that we need to look at and assess the vulnerability in the process. Then we need to look at the climate change and project the disease burden that would arise with the effects of climate change. Now, this requires a lot of work, not just for epidemiologists. It needs that multisectoral approach that Debisi was mentioning. We have to work with our colleagues in the climate sector. We have to work so that we look at, what the climate factors or the data and align it with the health patterns and burdens or trends that we're seeing that are aligned to, to climate change. We need to assess what are the public health interventions that we have. If it's, for instance, let's say it's malnutrition, what interventions have we created around that to support malnutrition, whether it's food distribution, those assessments that we need, nutritional assessments that we need to make, because we're able to project the climate impact issues that we will be looking at. And then we would then be able to develop and implement a climate health intervention plan. And if you have that plan, it will guide how we will address all these issues within the health system, because we cannot afford to look at health anymore with a siloed approach. We have to integrate all these aspects. So whether it's NCDs, whether it's HIV, whether it's malaria, whether it's COVID in itself, we have to have an integrated system. And so that is why I'm advancing the approach of looking at building climate change resilience within our health systems. And of course, the last step would be evaluating the impact and improving the quality of activities that we have in there. So I think this is something that we need to start looking at, how we can adapt a climate change resilient framework into our health systems. And that would, of course, lead us towards universal health coverage that takes care of all the spectrum of diseases that, that we need to address with climate change in the nexus. Thank you.
Thank you. Thank you so much, Nora. Do you have some specific examples, for instance, of how people have responded in terms of the nexus of health and climate change, how some initiatives have really helped combat this in the health perspective?
Within the African context, I would believe it's simply just looking at how perhaps malaria and its extending zoning is happening, whether it's in terms of getting more information out, whether it's in terms of the treatment management that we have out, the information that is being provided, trying to look at how the environment can be supported as we are managing the mosquito and it's the larvae, the whole process, the whole cycle of the mosquito. I think malaria, the aspect of malaria management and climate change, I think it's a good example that we can run with in Africa, because they have tried to look at how climate, environment, and how malaria, the epidemic in itself, is being managed in totality, without just focusing on just simply a malaria patient presenting at a clinic and managing them as that. Yeah.
Absolutely. Thank you really for that example that really contextualizes how we can have an integrated approach to how we deal with this health outcomes or impacts from climate change. Debisi, over to you. A question from Blessing, and he asked, can you speak a little more on the perspective that there seems to be a lot of innovation supplies to African agriculture and farmers, crops, fertilizers, capital, insurance, greenhouse, digitization, investment decisions, etc. But is there a way to prioritize these innovations inputs to avoid information overload that overwhelms local capacity and focuses little or lay perceptions and their demands?
Yeah, thank you very much, Liz, and thanks for the question. It's a complicated one because a lot of things still need to happen for us to go through agriculture transformation. So these technologies need to be in the hands of the practitioners. They need to have the know-how, and they need to also have the understanding of how to apply that knowledge. I think the innovation or the creativity then comes in how you synthesize and bundle these things together. Like I said earlier, a farmer, for example, doesn't need to understand the intricacies of how you design an insurance product or how you price lending, but surely they need finance. So they need to apply for credit. They need to apply. They need to get insurance. They need to have their investments covered or protected or hedged against shocks or stresses. So there is a lot of synthesizing and designing of new bundled products and services that put these things together. Ultimately, it's going to have to happen. There's an education curve or a curve of knowledge or education that farmers and practitioners need to get on. They need to improve their knowledge of what they're doing. And the reality is this: not everybody who is currently practicing agriculture should be practicing agriculture. It's brutal, but that's the honest reality. And the way I frame it is, I ask people a basic question: are farmers poor, or do we have poor people farming? Now, depending on how you look at that question, if the farmers are poor, then surely we need to ensure that the farmers are not poor. But if you have poor people farming, then you have to ask the question: do you actually want to be farming? Or is farming just the only viable economic opportunity around you? So how do governments and organizations encourage people to cycle out of agriculture? If you are right on the frontiers of vulnerability, you need to cycle out to other productive aspects or sectors of the economy. And for those who will remain in agriculture, you need to have the tools to be globally competitive. And what I mean by that is a rice farmer in Bakolori in northwest Nigeria, for example, is not competing with a rice farmer in Abakaliki in southern Nigeria. No, in reality, you're in a global market. So you're competing with a rice farmer in Vietnam, in Indonesia. And so your factors of production need to be competitive as farmers everywhere else. And it's only when we get agriculture to be addressed as a business that we bring this competitiveness. And it's that spirit of competitiveness that will, sort of compel us or force us to get the creativity to synthesize all these technologies. I hope, I'm not discouraging whoever asked the question, because it's important that everybody has these tools. You need these tools. So, for example, when you go to imagine education, imagine agriculture as an education, because that's what it is. So you don't end up. I mean, we've got Nora Abubakar and myself with PhDs here. We weren't born with PhDs, and we certainly didn't, go to a school of PhD. That wasn't the first education opportunity. We all went through the same basic primary school. Some of us then went on to secondary school, depending on the economic situation in your country. Some of us then went off to university for our undergraduates. And then some people bypassed master's degrees and then went off to do research. But that's the building blocks that gets you to the destination. So if we want to get farmers or get agriculture practitioners, proficient and, with the highest level of expertise, there are steps to be taken. So we need to go through the paths, and we shouldn't bypass. There are no shortcuts to being excellent. Excellence is excellence. So we need to go through the pathways that gets us to be excellent. And I think it's okay, to experiment with more creative approaches, to get us there. Thanks, Liz.
And speaking of the tools that you really reiterated in your pointer, there's a question here that was posted very much earlier that I think resonates with what you're talking about, from Euse Herzog. I hope I'm pronouncing her name correctly and haven't totally butchered it. She's asking, which is the correct way to inform farmers far away from knowledge centers, like cities, cities have hubs, about to alarming climate changes, that they learn to act in time in respecting the role of women as well?
Oh, Liz, I think that's a great question, and I saw it. I think if you are a farmer and you've been farming for multiple seasons, whether it's a livestock farmer or crop farmer, fisheries, aquaculture, intuitively, you have felt the impacts of climate change. You don't need any scientist to come with any charts to tell you about heat stress or even about the variability in rainfall or temperature. You felt it, whether it's early, how crops perform season to season, how early the yield develops, or in livestock, the vulnerabilities of whether it's day-old chicks or the weakness in the structure of eggs, or different, depending on what value chain you're in. You have felt intuitively impacts of climate change. So it's about extension. I talked about digital services and how you use digital tools to provide repositories. So if you think about something most of us can relate to. Think about YouTube. There's a how-to for most things on YouTube. So if you want to, I don't know what you want to do. If you want to disassemble a car's engine, regardless of the make and model, just type it into YouTube. There's probably somebody on there who's done a video. Now, so it's not just about the videos, but how do you validate and verify the quality of information on there? So we are working on repositories of know-how, how to do things. How do you improve irrigation systems? How do you design heat retention systems? How do you maximize output? There are all the how-tos that we're going to do. And I think digital tools or digital devices show the greatest promise in being the conduit for us to reach the most people furthest away from urban centers. That's my one big take on it.
Absolutely. And I think more to add on to that, there's lots of ministries of agriculture within the African continent that are really empowering agricultural extension officers who take this information then that they've learned to the community level as a way of ensuring there's the last mile of knowledge impact to the people at the community level. There's a very interesting question here from Jack Bwalaya, and it's directed to Dr. Abu Bakar, but I would love to hear Nora's input on this as well. So we'll start with Abu, then go to Nora on this question. How would you convince climate change skeptics who argue that climate change is a natural phenomenon and that our global climate has always fluctuated? Rises in temperature, extreme heat that we are now experiencing have also experienced before, and that changes in the global climate is merely a natural change or cycle. Abu.
It's going to be difficult to convince the person that it's a natural phenomenon, because I believe climate change is man-made in most cases. It's not a natural phenomenon. So I wonder what way I'm going to convince the person that it's a natural phenomenon. But whatever way we look at it, climate change to some extent is a man-made phenomenon in most cases, in terms of deforestation, logging of timbers, planting, agriculture, you name it. They say it's a man-made phenomenon. Even the COVID they are talking about quite recently, people are even thinking that it's not a natural phenomenon, it's originated from somewhere. Different schools of thought are saying different things. Even the Ebola outbreak we had in Sierra Leone at a point in time, they were saying it's not a natural phenomenon, it's a man-made. They are trying to experiment certain drugs, certain things that came into being. So in most cases, by and large, to me, it's difficult to convince the person that it's a man-made phenomenon, because whatever I've read through in most books, in most like climate change is due to human activities, global dynamics, transformation, technology, innovations that brings about different things, green gas emission, carbon dioxide, pollution of the air, deforestation, polluting the water, encatchment area, building houses around encatchment area, reducing water volume and water quality. So all these factors are man-made. So I wonder if I'll be able to convince the person that it's a natural phenomenon. I don't know, except otherwise.
Thank you, Abu. You really unpacked how it is man-made, and we are all clearly on that boat. And Jack will let us know whether he's convinced. Nora, you want to add something on that?
Yeah, absolutely. I think the challenge here is just about data. How available is the data out there to compare, these events, just across the decades and just looking at the trends. And I think maybe it's a challenge to us who are advocating that, yes, there's climate change and there are the effects, but how are we putting out the information there that, hey, the vector-borne diseases, malaria, is no longer something that we were seeing in an area near a water mass. Now it's happening in, in cities and urban centers. Why is that happening? And that is a climate change issue as well, but just how do we put out this information? Because the data is there. We've talked about, even as Edwin began this discussion, he gave the data, the numbers, the number of events that have happened due to climate change in Africa. And we can see what is happening. It wasn't happening before. Why would it be happening now? But the only thing that can support us at this point is data. And then how do we make data? How do we translate data information that can be consumed easily and in a way that greater populations can understand it, to see that truly there's climate change? So we understand it here as scientists in this discussion, but we have more work to put it out in a way that it is more
palatable.
Palatable. Thank you for the population. Yes.
Yeah. And
thank you, Nora. Oh, sorry. Yes, go ahead, Edwin.
Yeah, I was going to say, it reminds me of, for those of us who sometimes get into TikTok rabbit holes, it reminds me of a TikTok video I watched a few days ago where somebody was saying they ran an experiment in trying to get people to lower the use of AC somewhere in the global north. I don't remember the details. And so they hang things on people's doors. And the first one they hang on people's doors was, you're going to save money by turning off your AC and turn on the fan, right? And they saw absolutely no change. The second one they hang was, this is good for the environment because you're using less energy, blah, blah, blah. So absolutely no change. They hang one that says, your neighbor does it, so change, right? So people change purely on their social interaction, saying, okay, well, if my neighbor does it, I will do it. And I think that's exactly some of the gaps that we need to think about as we're asking, how do we help transform people's behaviors positively in the directions we want them to be? Yes, we tend to be, because we're intellectual, we'll say, well, here's the hard data about the thing. And we forget the social science side that actually helps us interpret how do people actually make decisions? What are things that allow people to change their own behavior? And could be something as simple as your neighbor does it, and then you see change, right? So there's that continuum that we need to fill the gap. And that's part of the reason. And I saw a note from somebody saying, is this just a group of, kind of intellectuals having a conversation and it doesn't go anywhere because governments are not involved? And I thought, well, Abu is representing governments in a sense. And yes, it's not all governments, but he is in a government body. But more importantly, the purpose of these webinars is to allow all of us to go into the rooms we're in and have the conversations with the people that we engage with on a continuous basis and say, how can we be part of the change, right? This is not about the 4 of us or 5 of us making change, it's about all of us making change. So how do we do it? And so as these experts come to these panels and we have these discussions, it's what do you take away from this and where do you take it to? Because everybody needs to be engaged and involved.
Absolutely. Spot on, Edwin. And I think this is where behavior change communications comes in, because it's not something that we can see tomorrow or the day after. It's a slow but gradual process that we inculcate in different people, so that even when there are things that and innovations we're working on to mitigate climate change on the different sectors, it's not going to be experienced tomorrow or the day after. It's for the generations to come. That was very spot on. There is a contribution from David Bonadou. I think it's a French name. I hope I pronounced it correctly. As speakers have alluded, there are many competing and pressing immediate needs and priorities affecting local communities across Africa. Given the paltry national budget, how can we ensure the perceived more long-term issue of climate change impact is given due diligence and resources it deserves? He goes on to mention, which I think is really important, that COP26 has helped to unlock financing, noting that COP27 is coming up, but it's still not enough, nor is it getting to the truly local level. Climate smart agriculture innovations, for example, have not been taken up in the levels necessary to ensure resilience of systems, as farmers cannot forego one harvest to try out a new drought-resistant seed, for example, or engage in trial and error? And this I will hand over to Debisi, because you did talk about drought-resistant seeds.
Okay, Liz, I think it's a great question, and it piggybacks off of what Edwin just said. This is not just a talk shop amongst people. It's not an echo chamber. Now, how does what we discuss here influence government decisions? It's simple. The science, you have different sort of ecosystems. Your science is generating the data, the information. You need advocacy to take that information and put pressure on people who will make decisions. So it's not just about, governments going to the UN Conference of Parties in Glasgow last year, for example, and saying, oh, our country will commit to net zero by 2060. When a head of state makes that kind of statement, and your head of state is 60 or 70 years old, so this person is not going to be alive by 2060. So effectively, they won't be around to live through the consequences of action or inaction. But it's civil society that puts the feet of government to the coals. It's civil society that puts the feet of private sector to the coals. You need advocacy, and advocacy works best when you have strong information. So you get the objective data, and then you can use that to put pressure on people who make decisions. Let me give you an example. The United States, during the campaign of President Biden, he sold the idea of the Build Back Better initiative. And I've been telling people, this is politics. This is how people need to understand the lens of politics. It's not just about grand, they say you campaign in poetry and you govern in prose. But in reality, you can do both. You can be as visionary and as ambitious as you want during your campaign, and also deliver once you're elected. But there's the politics of selling that idea to the electorate. So beyond the grand gestures, beyond white papers and documents the governments will submit during the UN system, we need to start seeing investments and action. Right? African countries get less than 4% of adaptation financing. The African Development Bank is leading through the AAAP, the African Accelerated Adaptation Program, working with the Global Center on Adaptation to tackle these issues, to ensure that we can get financing, to support national governments. And it's true, governments don't have adequate funding to do everything. You can't do it all. So how do you prioritize? I suppose you've got to, as the electorate in your country, it's your job to push for your interests, So you also have to push for governments to prioritize your interests. That's what determines your vote come election day, or that should be what determines your vote come election day, amongst other things. But also, once your government is elected, whether or not you voted for them, you as citizens of a country should put pressure on governments to prioritize. And how do you put pressure? You put pressure based on the information you have. And so if we can synthesize the data, synthesize the knowledge, that helps you to be a better advocate. And everybody can be an advocate. Just as you are asking us questions on this webinar, you can ask your government questions. Over to you, Liz.
Yeah, and we hope through these sessions and these webinars that we've been having, the part of the outcome we really look forward to is everybody becoming an advocate of the different topical issues that we really push out on. There's a question here from Raymond Obare. How do we ensure that climate change is a mainstreamed issue in global health, especially by development organizations, in quotes, nonprofits, including adopting a climate action and justice approach in programming? Nora?
Thank you. I think this is something that is way overdue and is the reason why we're discussing climate change, health, and the gender nexus in this discussion today. And I think I'll just pick on the basis. We must advocate. We need the data as well. And that is why I'm talking about having, a resilience plan within our health systems, because if the plan is not there, even in the strategic plan of countries, that we need to address climate change in global health, like in our health agenda, it will not be financed. So we need to be able to say that this is the issue that we are facing. This is the data. This is our priority, and it is guided by our strategic plan, and therefore we can advocate for its financing in that regard. So this has to reflect in our strategies and policies. From that way, then we can attract funding for this as well. But as we said, you know, the government priorities are very many. We can't expect the government to do it all, but we can really start the process of advocating for this for these issues. And when we're looking at, of course, the issues, climate justice, as part of JEDI, where we're talking about justice, equity, diversity, and inclusion, all these things need to be included in this process where we're discussing climate change and the interventions that we want to put forward to ensure that, you know, that climate justice is something that we're looking at. We as Africa, we are not the ones contributing the highest amount of emissions, yet we are the ones facing the highest burden. So we need support. That money needs to trickle down. The amount of money we need, even just for Africa, I think it's about 3 trillion in mitigation and adaptation by 2030, so that we can implement this. It's a lot of money. So we need to be supported. We have signed up and ratified the Paris Agreement. All Africans are committed. African countries are committed to enhancing climate action. But we definitely have to have support on this. And so advocacy, data-based advocacy, let's have it in our strategic plan and policies. Let's acknowledge that this is real, climate change is real, and it is going to determine the future that we might not even be there in, and we want to secure it for our young population. So I think that would be my rallying call on this.
Yeah, and indeed, Nora, it is happening to some considerable extent in a lot of development organizations. The donor landscape is also changing in terms of investments, and looking at, you know, organizations and civil society groups that work towards mitigating the impacts of climate change. A good example is Amref Health Africa, one of the, you know, largest health development organizations in Africa, looking towards health access for all Africans. And one of the things that I know we have prioritized is climate change. And we've had several sessions around how we can ensure we rally the call, not just about the nexus of climate change and its impact to health, but also the larger picture on how it impacts on the economy, on women and girls, on, you know, various other aspects. And this is a conversation that we had during the World Health Assembly. It is a conversation that we will continue to have through this Africa Dialogues, through the upcoming COP27, through the 77th edition of the UNGA that is happening, the United General Assembly that's happening just in a couple of weeks, and also the AHIC 2023, which is a conference that we bring together various stakeholders in the, what you were talking about, Nora, bringing different multi-stakeholder people to discuss pertinent issues, which takes me to a very interesting contribution from Julie Truelove. And I realize that we are running out of time. It's just really engaging. I'm so excited. Like, everything everybody's saying is very important. Julie Truelove says, reflecting further on collective action for confronting climate change and determinants of health, how do we bring key sectors together across institutions, agriculture, health, environment, and others to operationalize solutions strongly? Abu, I'll come to you. And the question here is, Julie is wondering, how can we, instead of having a treaty or a declaration that only focuses on agriculture or on health or on environment, how can we have treaties that encompass or integrate all these aspects? Or is it already happening?
Yeah, thank you so much. It's happening for some areas and not happening for another area. Even if you take country specific, you will notice that even within the MDAs, most of them, there is an overlap in terms of roles and responsibilities, and everybody wants to take credit for a job well done. But if those countries come together, or those departments, MDAs come together in a collective manner, and then try to separate or allocate job responsibilities to each and every sector in terms of data collection, data analysis, impact sector analysis, and then distribute the national budget equitably within these different sectors, I think we'll be able to achieve the desired objective. But in most other areas, you notice that certain MDAs or certain ministries, they want to take laurel or praises for a particular job done, if ignoring the whole. And this is not a situation where you have subsets or you have individual praises. It's a situation wherein you have a collective coordinated effort in order to achieve a desired objective. And from insight or from inception, each and every MDA must be given its role and responsibilities in terms of job description. Whenever you employ any individual ministers or deputy or what, there must be certain roles and responsibilities allocated or designated to that particular ministry, so that there will not be an overlap. Rather, they will rather complement each other in order to achieve a desired objective. So each and everyone must know its function, its role, and then try to coordinate. There must be a line ministry that tends to coordinate all these activities of the various MDAs in order to achieve a desired objective. So the issue is coordination, coordination, and coordination, rather than acting as fighting each other, but they must try to complement each other's effort to achieve a desired objective. Thank you.
Thank you. Thank you so much, Abu. Edwin, yes, I see you.
Yeah, I was thinking as we're coming to a close, I had one question from all the panelists, right? We've had a great conversation that has been centered on how challenging this is, right? Where are you seeing at least one or a couple of rays of light, right? Bright light, you're saying, if only we could take X and scale it, if only somebody could do what is happening here and take it somewhere else, we could actually build positive momentum so that what is a big collective action issue actually starts, folks can say, okay, that's happening there, that's happening there. What are some examples of that you'd want to share with the team, so that everybody feels they can take something, right? That they can take with them after this webinar. Debisi, I see you smiling broadly, so I'll ask you to go first.
Yeah, okay.
Then I'll do Abu, and then Nora, you'll close us out.
All right, thanks, Edwin. Two things I'll mention on the climate change nexus. First is the Technologies for African Agriculture Transformation, initiated by the African Development Bank. That's brought so many African countries together, concentrated finance, specifically in areas of high production. And we're starting to see the green shoots of success. So Ethiopia and Sudan, for example, have moved from net importers of wheat grain to net exporters. And that shows transformation. And once you can show transformation, I think you build that momentum, you create a juggernaut that creates successes elsewhere. The other aspect is the African, it's the African Accelerated Adaptation Program, AAAP of the African Development Bank, of articulating not just what the challenges are, but bringing together the partners and the investors for success. Again, like we said, not all countries can afford to do everything at the same time. But that doesn't mean that you can't get the right partners to finance certain aspects. So bringing together that framework and ensuring that you have public sector financing, private sector financing, development financing, creating a blended structure all through the whole thing to ensure that you can create, a multi-year strategy around agriculture transformation. And that's already, again, starting to show the green shoots of success. Last year, we had the Food Systems Summit. Around the world, countries around the world had extensive consultations on what it meant to transform food for inclusive prosperity. And so each country now has a compendium of strategies that was internally generated, not foisted on them or foisted on them by any external party, but internally generated that can serve as a roadmap for true transformation. So whether you as a citizen, active citizen who wants to hold your government accountable, there is a roadmap now to hold your government accountable. If you as an investor wants to invest for the future, there's a roadmap, et cetera, et cetera. So I'll leave it at that. We've got the green shoots, and yeah, agriculture in Africa is only going to get better, and Africa will feed the world. I believe that.
Hey, Abu?
Yeah, thank you so much. It surprised me so much when we saw this outbreak of this Russian-Ukraine war, and then we came to realize that Ukraine was almost feeding the whole of Africa. That was a big slap on the face of Africa and the African continent. Ukraine, that is less the population, less the size of even 1/4 the size of Nigeria, can feed the entire continent. It's a big slap. But what I think needs to be done to enhance, to boost agricultural productivity or mitigate the impact of climate change, like Dr. Debisi said, one way is the research and innovation. Countries must be able to invest in research and innovation, bring about advanced technology that will enhance rise of agricultural productivity and then mitigate the impact of climate change. And also in terms of research and innovation on new techniques in terms of building immunization, medical facilities, and then makeshift clinics for population in rural areas to enhance their thing. Another thing is the leadership and governance. It has to be very key and very critical. Government has to be held accountable. There are some areas, in fact, some studies have shown that natural resource endowment is more of a cost than a blessing to specific countries, because the way those natural resources are being utilized, are being effectively utilized, and some of them are recipe for political impasse, like we normally saw in the Sahel region and some other areas. So government must own up to its responsibility, create a kind of enabling environment, ensure that the natural resource endowment is effectively and transparently used for the benefit of all, so that whatever comes out of the national cake from that can trickle down to the poorest zone, and then everybody will be happy, and then there will be peace. And we also talk about the public-private partnership. It's very key. Government, even though they have the power or they have the responsibility to provide for its citizens, but yet still there must be a synergy, a marriage between the private public sector, because in most economies, economic growth is mostly driven by the private sector. So private sector engagement is very key in terms of this. And the other thing and most important, there must be that regional approach in the implementation of certain activities in terms of, like, for instance, infrastructural upgrade, research on medical facilities, and then transboundary water issues. There must be a regional approach to create this kind of enabling environment wherein there's going to be a win-win situation for both parties engaged in the discussion or the project and the like.
Right.
There must also be the last thing, that countries must also practice, especially Africa, the comparative advantage scenario. We notice that, like, inter-African trade is very low because all countries depend on specific kind of productive capacity that they produce almost the same thing all over and again. Countries must be able to engage in areas where they have comparative advantage and allow other countries to operate where they also have comparative advantage. So at the end of the day, there will be a kind of inter-trade between these member states, which will also boost economic growth, development, alleviate poverty, create a kind of healthy and stable environment. So these are my takes now.
Fantastic. Nora?
Quickly, because of interest of time. However, under the health sector, I think Africa is looking at universal health coverage. That is our end goal. It is not an easy process. There's the financing that is required, but it is how we would want to look at it with climate change and its effects is how we can work across borders, because climate change is not going to be something that's affecting Kenya alone. It's not affecting Senegal alone. It's not affecting Mozambique alone. So we can look at how to integrate climate change effects to build the resilience of our health systems. I think that is a way we can move forward. Integration is key here. Looking at vulnerabilities, defining vulnerabilities in our context is critical. Engaging communities meaningfully across all areas of vulnerabilities or marginalization is critical. Data diversity is critical. Equity impact assessment is critical. Looking at public health resources and ensuring that we are looking at justice, equity, diversity, and inclusion is important, and particularly multi-sectoral approach. We cannot do this on our own. So I'm looking at all our health systems in countries, whether it's the AU or we're looking at the East Africa Community or ECOWAS, we need to have a common agenda as we are trying to address climate change. And it will come with ensuring that we are building resilience against climate effects in our health systems. We can borrow from CDC's framework in existence and start looking at how climate change players can engage with the health epidemiologists, and we start looking at anticipating our impacts and looking at projections on climate versus disease burden that's coming with climate change. So I think that is our way forward. It is not impossible. We will start with the low-lying fruits to ensure that this conversation is going on in the health sector. That climate change is real. So let's do the data, let's advocate, and let's have it in our processes as well. Thank you.
Thank you very much, Nora. And on behalf of everybody who's been on the webinar, thank you all three panelists. I think you've been tremendously useful in doing three things, at least for me, right? One is reminding people this is a big issue, right? It's a massive, massive issue. We tend to focus on the shocks, but we forget that there is some of that, kind of transformations of lives, livelihoods, nutrition that is happening collective that will have a bigger impact down the line. We just don't see it because it's not a big shock. So it's a big issue. Secondly, it's so big that we all have to engage with it, right? Which means anybody who's on this call, there's something you can do to actually make it easier, make it better for the way Africa and Africans experience and respond to climate change. So everybody should leave here thinking there's something I can do myself with my organization, with my network, with the ecosystem that I have voice in. Please take these comments, these thoughts, these ideas back. And as Liz mentioned right at the beginning, this is a recorded webinar, so it will be shared widely. Let's stimulate the discussion and conversation. And then finally, which is where we'll close, because there's a really good video to help us close. There's something you as an individual can do in your own life, right? And so also take that action, because collective action is about a lot of individuals doing things that becomes the whole. And unless we start now and start somewhere, we will keep having webinars and saying it's such a big issue. I wish we had done it sooner or later. And then we'll become overwhelmed by the impact, but there's actually stuff we can do now. So thank you to the three of you panelists for incredible conversation. Liz, I don't know if this will end up in the small cut that get the 3-minute cut that gets shared. And Dr. G says you are a fantastic moderator. Please stay. We can do without him. But of course, to our audience who joined us, all 150 people, thank you for being part of this discussion. And I'll ask Maurice to cue the video as we sign off. And I wish you all the best. The next webinar, I believe, is in about 6 weeks. As normally, it will be communicated over email, over social media, on the content and the panelists that we'll have. So look forward to engaging with you all on that next webinar. Asanteni sana.
Thank you so much, everybody. Thank you.
Kwaheri.
Thank you.
Thank you, everyone. Bye.
Thank you, everyone. Bye.
Which one? Oh, boy, it was okay.